The Bullet Points Project is an initiative funded by the state of California to help educate healthcare providers on how to identify patients who are at risk of firearm injury or death, and to give them tools to help mitigate that risk. I'm an emergency and inpatient psychiatrist, so I do a lot of violence and suicide risk assessments. And I realized that we, as healthcare providers, are not well equipped with the tools to address these kinds of violence and to identify patients who are at risk of it. And I wanted to help educate people so that they would know how to identify patients who are at risk of firearm injury and have some tools that they could use in the clinical setting to reduce that risk.
Good to see you today, Jeff. What brings you and your daughter in?
Our online continuing education course is built around clinical vignettes, where we present 3 different patients through a video who have some sort of risk for firearm injury or death. So they may have suicidal thoughts, they may have a child in the home, they may be experiencing intimate partner violence. And we show how a clinician interacts with each of those patients in that clinical scenario, how they identify the risk and what they do to address that risk in that specific patient in that situation. We use a framework called the 3 A's, where we talk about how you can approach patients like this, how you can assess them for their risk of firearm injury and whether or not they have access to firearms, and then what tools you have to act to reduce their risk. This course is available free, on demand, and online to any healthcare providers, or actually anybody who wants to take it. But healthcare providers can earn either 1 continuing medical education credit through the California Medical Association or 1 continuing education credit through the American Psychological Association. So you can access our online continuing education course at the California Medical Association website or at our Bullet Points website, which is bulletpointsproject.org. And our website is also a great resource for other information, where it outlines clinical scenarios in which firearms pose a heightened risk of violence or other injury. And it gives clinicians tools which they can use to address that risk and help mitigate it in individualized patient situations.